This is going to be Chapter 8, Illness and Injury Prevention. Key concepts that you'll understand after this chapter: the impact of public health prevention programs, decision-making based on surveillance of injury, the Haddon Matrix and injury countermeasures, the 4 E's of injury prevention strategy, evaluating an injury prevention program, and recognizing teachable moments for the paramedic. Public health. The focus is to promote the wellness of a community or a people in order to improve the health of a population. Tenets of public health medicine are consistent with the concepts of primary care. In primary care states it is easier to prevent the disease or injury than to treat it. The public health treats the communities and the primary care treats the individuals. So, public health concentrates on the detection of community-wide disease and the creation of programs for injury prevention. And this reduces the cost and has lots of economic benefits. Many people believe that public health is rightfully a function of the government. Impact on prevention programs. In the past, the spread of infectious disease was kind of rampant and mortality was high. Quarantine had a varying degree of success. In the last century, the average life expectancy has increased over 70 years. This is due to the improvements in preventive medicine and a broad public health measures like sanitation and purification. Public health prevention initiatives were all chosen because they represent an area of significant mortality for the public. An example of this were like family planning, smoking cessation, workplace and motor vehicle safety. Success of these initiatives can be seen in the efforts of public health to influence family health and planning. Now, infant mortality due to this has dropped 90%. Maternal mortality has dropped 99%. And improvement in motor vehicle safety has made a marked decrease in mortality and morbidity. These are examples of paramedic public health initiatives. Pedestrian safety, bike lanes and sidewalks would be the example of that. Bicycle safety, helmet patrols, ice cream tickets for doing a good job. Hey, you got your helmet on. SIDS, back to sleep programs, drowning prevention, pool inspections, child safety, child passenger safety would be child seat inspections. Food safety would be health inspections. Injury surveillance. Injury and illness detection is the first step in prevention. Research and statistical data is used to assess the need or revision of preventative programs. Consistent with a plan, do, check, and act cycle, and this is cycle we get this from quality improvement. So we made a plan, we did it, we're checking it, and then we're acting upon it. Early efforts at injury surveillance were made by Ralph Nader, and this was Nader's Raiders. They investigate and report to the public items and goods that are deemed unsafe. It results in recommendations for action. One area of concern was high incidence of mortality caused by an ejection from a motor vehicle. And due to these efforts, it influenced preventive requirements. They put a pin, essentially, in the car area, and the pin was actually even named a Nader pin. Trauma surveillance. In 1983, the National Academy of Sciences, Injury in America, emphasized that injury prevention was more cost effective than injury treatment. Center for Disease Control was tasked with injury surveillance. They created a division of injury control, which is now called the National Centers for Injury Prevention and Control. 10 national injury prevention and control centers across the country focus on regional injury interests. And these are the National Centers for Injury Prevention Program. The University of Alabama, University of California at Los Angeles, California at San Francisco, Harvard School of Public Health, University of Iowa, Johns Hopkins, North Carolina, Washington, Pittsburgh, Colorado State. National Trauma Registry. The National Trauma Registry compiles injury statistics maintained by regional trauma centers, and the data sets are taken from patient care reports. They're valuable information regarding topics for continuing medical education and professional development that you can get out of these courses, or that you can get out of these PCRs. An example of this, statistically, what part of the population would have a higher incidence for gunshot wounds? Well, if you tabulate all of these EMS documents in the trauma registry, you can clearly see formation of possible areas where the incidence would be higher. And those would be the areas that you would increase your injury prevention programs on. EMS and Injury Prevention, 1996. National Highway Safety and Traffic Administration put out the role of EMS and injury prevention. A firm position of EMS as a legitimate source for injury prevention education. Injury prevention theory and the Haddon matrix. William Haddon Jr. pretty much come up with the injury prevention matrix, and it was essentially a concept map of injury causes and prevention. Now, there was plotted factors that the cause of the injury across the horizontal axis, or x-axis, and the stages of the injury across the y-axis. Each square of the Haddon matrix represents an opportunity to intervene. The horizontal x-axis contains the elements, the host, the agent, and the environment, and marked along the y-axis are the stages of injury. So the pre-event injury, the actual event itself, and then post-event. And then injury countermeasures. From this, you could plot some statistics off of this. So Haddon's 10 levels of countermeasures started from pre-incident or preventative measures and proceeded through the post-incident or clinical medicine part of it. Yeah, this is an example. Pre-incident, incident, post-incident, and the host were children age 0 to 4. These would be the horizontal, and then this over here would be the vertical. I'm going to clear this off so you can see it. So, back up one. This would be the vertical axis, and then this would be the horizontal axis. In the horizontal axis, host, agent, what environment they're in, and then their social environment. And then in this was before the incident actually occurred, the incident itself, and then the post-incident. Now, if you plot all of these out, you'll see specific areas to where there would be problems, or a matrix to where you could apply this so that you may be able to apply preventative measures. Let's go to the next slide here. Injury prevention strategies, the 4 E's. Engineering, education, law enforcement, and economic incentives. So examples of these. Engineering. Addition of safety devices during the engineering phase of product design. Education would be requires the educator change the behavior of the host, the population, in a substantial manner. Law enforcement. This is a form of learning as well. It's just a kind of a form of negative learning. Law enforcement provides punishment for nonconformance with safety regulations. And it's a form of operator conditioning, if you will. Economic incentives. There could even be economic incentives there as well. Economic incentives, this is a form of education. And economic reward. So this would be something like your insurance company deducted or allowed you a coupon or a discount if you did this. A form of positive operator conditioning. Now, you can have a negative operator conditioning with the law enforcement again that would probably cost your pocketbook if you did not conform to the regulations. Assessment. Quality improvement cycle. We have planning, and in planning there needs to be a cost-benefit analysis. Is this worth what we're trying to do? And equity is essential. So an equity pretty much is a concept of fairness. Horizontal equity refers to the changes that broadly apply to all individuals. So if we had horizontal equity, this would be the standard. And I think the book used an example of this. In preventative, measures, which were prevention of drunk driving, that pretty much in most states are that the alcohol intoxication level is 0.08%. So that would be a horizontal equity. And a vertical equity refers to injury prevention programs provided to one group of people. So from the Haddon matrix, let's say that you had a specific socioeconomic grouping that showed a higher incidence of gunshots to children ages 0 to 4. So then, in that vertical equity, you may actually want to utilize that information and target that group to provide better prevention strategies. The paramedic must be sensitive to stigmas, and what a stigma is a negative connotation attached to participation in a program. Now, examples that they used in the book is if you found drug abusers and was wanting to get them off of it, like off of the drugs by utilizing press, media, and other additional resources, you might not get such an approach. But then it uses a positive example in the same paragraph where it's talking about Alcoholics Anonymous. The reason that group has been so successful is because the members are anonymous while they're actually going through the group meetings. Feasibility of proposed changes must also be assessed. So may require reallocation of essential resources. And an example of this, the problem with reallocation of essential resources in an EMS service is most of these preventative programs are under the influence of politics. So as politics wax or wanes, funding for these special interests may go away. Implementation. EMS leaders must first get paramedics to invest intellectually, spiritually, and in these programs. Paramedics may minimally demonstrate those safety habits that they would have the public emulate. An example of this, public may imitate their actions, and it could have positive impacts. So imitating the public actions, examples of this would be wearing your seatbelt, turning your lights on while driving in daylight, and things like this. The public may see you being a leader and actually start to emulate some of these good traits. Teaching injury prevention and using a teachable moment. Teachable moments are times when the patient has a heightened awareness of the problem and is perceptive to information. Now, an example of this would be, say, in a diabetic wake-up. The patient that you're responding on took their insulin and did not eat afterwards. They got busy or doing something. So after you've corrected them and you're talking to them, just reinforce it's very important for you to always eat after you take your insulin. I know you probably got busy today, but please be positive and please reinforce. Victim blaming is kind of counterproductive on this. The paramedic should be supportive and non-judgmental. You're trying to educate. EMS injury prevention programs. Some may be hesitant of taking on a new role. Model for EMS success and injury prevention is the EPIC Medic program in San Diego. They used home safety assessments, pool safety inspections, and child passenger seat safety education. Eliminated preventable injuries in children, and they were given an award because of this. The EPIC paramedics were awarded the Nicholas Rosecrans Award, given to an agency or individuals for community work with injury prevention. And this is picture 8-1, EPIC team receiving the Nicholas Rosecrans Award for excellence in injury prevention. Outcomes. Actions without reflection are ineffective. There is no measurement of change. Statements about any injury prevention program require verification, and there's a process of evaluation, and it has to be an integral part of an injury prevention program. The measurement has to be data-driven, should involve both the means and the ends. And the measurement of the means is a process evaluation. So this includes statistics on attendance, among other items, and explains how the program was implemented. A measurement of the ends, or the outcomes evaluation, matter of comparing the level of injury or illness before and then after the program. In conclusion, many opportunities for paramedics to work with the public health, with the aspect of the avian flu epidemic and obesity and proliferation of drug-resistant diseases. Strategic alliance can be synergistic and provide the best outcome to the public. References for this lecture were taken from Professional Paramedic, Volume 1, Foundations of Paramedic Care, First Edition, pages 118 through 129 in Delmar Learning. If you have any questions, feel free to contact me. My name is Roy Smith at smithr@imsa.net or 405-219-7613. Thank you.